This is Raylene Pinones, and I chose to do my final project on C. diff. The scientific name is Clostridioides difficile. So it's from the domain Bacteria, phylum Firmicutes, class of Clostridia, order Clostridialis, family Peptostreptococcae, from the genus Clostridialis, and the species is, of course, C. difficile. The reservoir is found in the human gastrointestinal tract. Within healthcare environments, it's found on spores on surfaces like bed rails, toilets, and medical equipment. It is also sometimes found in soil and animals. In terms of its morphology and characteristics, it's rod-shaped, it gram positive. It is obligate anaerobe in terms of its oxygen requirement. Spore forming, it forms highly resistant spores. Motility, it has pretrituous flagella. In terms of toxin production, it produces both toxins A and B, which can cause colonic inflammation and damage. One of the unique traits is that the spores can survive for long periods on surfaces. For its transmission route, fecal-oral route is usually the only route that it is transferred. This is done or found by ingesting spores from contaminated hands, surfaces, or objects. Healthcare-associated transmission is common in patients in hospitals or long-term care facilities are at high risk, especially after antibiotic use, which disrupts the normal gut flora that we already have. So this is just the visual structure. So it has a complex structure featuring a gram-positive cell wall with a crystalline protein S layer, a unique peptidoglycan cell wall, and a spore structure with an exporium coat, cortex, and core. The S layer is composed of SLPA protein and other associated proteins, which is crucial for virulence and acts as a protective shield. The spore facilitates transmission and survival in the environment, while vegetative cells produce toxins like TCDA and TCDB to cause disease, so toxins A and B. So in terms of clinical relevance, why it's important, C. diff is a major cause of healthcare-associated infections and can lead to severe, recurrent diarrhea and life-threatening colitis. It's especially dangerous for hospital, elderly, and immunocompromised patients. Diseases caused, it's the C. diff infection. Symptoms include mild to severe diarrhea, colitis, toxic megacolon, sepsis, and death in extreme cases. In terms of its pathogenic mechanism, the pathogenesis of C. diff infection is a multi-step process involving the disruption of the gut microbiome, bacterial colonization, toxin production, and ultimately damage to the intestinal lining. So in terms of treatment and prevention, treatment includes antibiotics. Even when treated with antibiotics, the infection may come back. In rare cases, fecal transplant or surgery may be needed. To prevent the spread of C. diff, you should use antibiotics only when necessary and take them when prescribed. Practice hand hygiene, of course, clean and disinfect surfaces regularly, and avoid sharing antibiotics. C. diff prevention is crucial in nursing practice because nurses are on the front lines of transmission. And the infection is a common, potentially life-threatening cause of healthcare-associated diarrhea, leading to severe illness, death, and high healthcare costs. So thank you for listening to my presentation, and these are my references.